Hello friends, welcome to UK Dreamers. This is Aman, and in this video we would be discussing about the challenges that you might face at work which make you feel you want to quit your jobs. So as a circle of life, you'll have your good days and your bad days, good moments and bad moments. So to make it simplified, I have divided the problems or the hardships into three different big groups. The first one, we would be discussing the problems faced with patients, the problem faced with the relatives, and the problem faced with your working colleagues. So let's start with patients. So as medical healthcare professionals, our whole sole aim of the life is to make the lives of patient better, to heal them, to get them pain free, try to make them better, in short. But what happens is, most of the times you would succeed in it, but many of the times you would get patients who would need a sort of special approach. So the first difficult scenario amongst patients is patients who over expect things. So like, you're treating someone with a possible lung infection, you're worried about their lung infection getting worsened or something, but they want something else. As in, they are okay that they've come to the hospital, you'll sort their lung, but they also want to get chronic things sorted, like, they've got knee problems, they might be awaiting a knee replacement, and they want you to get things sorted straight away. They want you to get the, orthopedics, they want you to get the MRI scans, they want a definite date for the surgeries and everything. So such patients can be difficult to deal with, but the way to go for this or go behind this is try to give them a logical explanation, offer them, alternates. If they don't agree to it, have a chat with your registrars and your consultants, who can go and further have a chat with them. Escalate it to the nursing in charges, who can also, have a chat with them. So I'm not saying you shouldn't treat them. If they've got a knee pain or something, treat them medically as much as you can, but don't do false promises that you would, sort a MRI scan or sort something, because whatever you say to them, you are an NHS worker. So you might not be there in the wards or the clinics the next day, but your colleague would be, and they would be in a difficult situation. So if the patients are over expecting, please do not curb their, expectation by throwing false promises. This is not good. This is not professional. The second sort of patients are the unhappy patients. So no matter what you've offered them, medically, the plan or the future plan or the overall prognosis of the disease, they are still not happy with the explanations that you've provided. They're still not happy with the treatment you've provided. They want to officially launch a complaint against you, your consultant, anyone. These sort of patients, I'm not saying they're wrong. They might be right in their, the way of approach, but as a clinician, you have to make sure that anything that's life-threatening needs to come first, and the rest everything can come back later. The sort of example I would place is, I recently saw a young patient who had malignancy, presented with shortness of breath. We are expecting, whether the patient has a pulmonary embolism, because the patient is on high risk, start them on treatment dose enoxaparin, book them a CT pulmonary angiogram, but the patient is absolutely stable. So you offer them that, that the scan would be done maybe, next day. Like, okay, this is a conversation happening, say for instance Saturday, so you tell them that it would be done by Sunday afternoon or something. Patient is very angry. Patient says that you don't care for him. Patient is saying that, you're putting their lives in danger. However, you've still started the treatment dose of enoxaparin and everything. So with such unhappy patients, make sure that you are documenting everything right. Make sure you're treating them right. Okay. Please don't, take into priority whatever they are asking for, because, at the end of the day, your practice is evidence-based, and you have to follow those evidence practice rather following an individual approach to the patients. The third patients in general are the rude patients. They can range from being politely rude to extremely rude. You would face them at some point of time while working, not only here in the UK, but wherever you're coming from, you would face them. So for instance, I would tell you a simple example. So I saw this elderly gentleman recently. So he presented with a urine infection, and the moment I went in with my consultant, he clearly says that he does not like brown people around him. So, for instance, I was like, okay, so he doesn't want me near him. I just looked at my consultant, and she was like, the moment she heard this, she, immediately replied back to the patient saying, "What are you saying?" Then he's like, "Yeah, I don't like brown people, so I don't want a brown doctor near me." And she's like, she has lost, the control over, because this is not acceptable, which we totally all stand for and agree. But, I didn't mind at that moment, because maybe he's a urine infection, maybe he's delirious, maybe he's intentionally saying so, I don't know. So, after we had a brief chat with the patient, I came back, and my consultant was apologizing to me, saying, this is not right. And if I want to raise an official complaint against this patient, she would back me up. It felt nice because your colleagues are supporting you, but yes, on and off, you would face such patients, here and there. And, it's what to say, it's just, part and parcel of the duty that you're doing, basically. So another day, one of the patients told me to bug off, F off, whatnot. But, as I say, abuse is something that you shouldn't take lightly. If you think that you've been abused, verbally, mentally, physically, escalate it to your consultants, escalate it to nurse in charges. Don't suffer alone in silence, okay? Just because you are not very used to the system doesn't mean that you should suffer in silence. Otherwise, patients are lovely, especially the elderly population in this country are absolutely, gem. So let's move on to the next section of difficulties that you might face with the relatives. The most common related complaint or the difficulty that you would face is the controversy of who is the next of kin. So here in the UK, usually someone is designated as the next of kin. So any patient related information directly goes or gets discussed with the next of kin, of course, if the patient agrees. So at times, if someone has 3 sons or daughters and they have a conflict among themselves, they would call you saying, you are not supposed to discuss this with this next of kin. Patient does not have capacity. For instance, patient has got a dementia and they don't have a capacity. So now you get stuck in a complex family matter where someone wants information, someone doesn't want information. And how do you go about it? Because you would be getting hard on hitted by the next of kin who actually doesn't want this information to be given to anyone. So in such cases, make sure who is the official next of kin as per the documentation. Write a document whenever you're discussing with the next of kins. Whenever you're giving them an update, try to write it as detailed as you can. The questions that they are asking, the answers you are offering, the concerns that they've got, and hence and so forth, But make sure you escalate this to the nurse in charge and the consultants, because the next of kin dispute is something very, very common and you all would face it at some point of time. The second difficulties that you might face would be with the unsatisfied relatives. So for instance, as I said, elderly population, lots of comorbidities, lots of things pending, lots of things in waiting. So you get stuck in a place where whenever you are trying to offer them something, they would be like, no, this is what was said the second time, I'm not coping or I'm struggling. So address their concerns as much as you can. Okay, please do not, as I said earlier, please do not give a false commitment to anything that they ask for. Discuss it with your seniors whenever you're facing such situations. For instance, if someone is having a package of care 2 times a day, and if your occupational therapy has decided it should be 2 times a day, you should not do a false promise. Okay, I will escalate it to 4 times a day, just because the relative was being, a little hard to discuss things with. As I said earlier, things work in an evidence-based way here in the UK, so please don't carry it away with emotions. Yes, we should be emotional, we should show empathy, but meanwhile, our focus should also be on treating the patients correctly and not as per their needs, but actually as per their requirements. The third thing is the difficulties you might face is about the ownership of the patient. So for instance, if there is a patient who does not want to be resuscitated, but the relatives and the family wants you to resuscitate them. So there's a clash of the ownership. Patient says that he is the ownership, he is the ultimate boss of his own health, but relatives are like, no, he does not have mental health capacity, or he's sick, he's old, he doesn't know, and so many things. Again, guys, if someone has a mental health capacity and you have done the mental health capacity assessment, if they're deemed to have capacity, you should obey their needs and their wishes. You should respect their wishes, basically, not as per the family, because everyone wants their loved ones to stay alive for a long time, but the patient has got n number of comorbidities and they don't want to get resuscitated, which you should allow them their dignity. So don't fall get into these what to say difficult situations where the relatives are just not understanding. So don't try to mismanage this. Get a mental health capacity, discuss with the patient, always discuss with the consultant, because in case you need to place a respect form, a consultant needs to sign it up. Ideally, registrars and above should be doing the respect forms, but you can always discuss this in your morning huddles, or when you're referring it to a consultant or a different sort of specialty. Always discuss this. Let's talk about the third section of today's chat: difficult colleagues. You all will face them, we all face them. So what to say, there's too much sort of challenging ambience here in the UK. So everyone likes to challenge, everyone likes to question you, which is okay till a certain level, I would say, because if you're making a mistake and someone is saying, oh, you're doing this wrong, which is absolutely correct. But if every now and then someone is actually challenging every A to Z of your treatment, it becomes difficult. It becomes very difficult. Let's talk about the first group in this. Of course, your fellow doctors. For instance, when you're referring it to a specialty, very difficult at times, guys. You've got an elderly patient who feels like they've got a slightly vague sort of abdo pain, but they've got a lactate of 3, and you're trying to make sure that the patient doesn't have a bowel ischemia or diverticulitis, whatnot. Referring these patients to specialty can be a big challenge. Like if you want to get it vetted with the radiology, again challengeful. With the surgeons, challengeful. So it depends on day to day. I've had my good days and I have had my bad days, because once you call them, you tell them the story, they're very happy, they're very easy, and things get sorted very easy. At times they would be in absolute pain to you, and it doesn't go well. Okay, but that happens. What to do with it? So basically you have to deal with it. At the end of the day, you just can't do anything about it. Second, what you can face is a sort of rude colleagues. In short, like for example, if some of the senior in the department, you go to them for advice and their response is, so what am I supposed to do? What can I do? Why don't you do this? Why don't you do that? What are you doing with this patient and everything? So you would face rude colleagues everywhere in the world. So if their rudeness is something you can just tolerate, just move ahead, guys, go ahead with it. But if you think it's way beyond what you can absorb, always discuss this with the on-floor consultant or the nurse in charge. So for example, I'll give you a simple example what I saw a couple of days ago. It was one of the other specialty registrars who came to the ED to help us. So apparently one of the colleagues was like said something rude, which this colleague was absolutely bombarded, and he's like, I'm here to help you guys and this is what I get in return. And now there's a clear-cut confrontation between this colleague and the one who has come to our department to help someone. And I was in between, so I don't know both of them, but they're both coming to me saying he was wrong and he was wrong. So I went to the nurse in charge, plain and simple, and I said, see, there's a confrontation between these two guys. I don't know who's right and who's wrong, but I would request you to kindly step into it because it's getting a little out of hand. So the nurse in charge came, had a chat with both of them. They went both their own ways, but you would face such situations. So make sure whenever you face, see, human nature, someone might not be in a good state of mind by then, maybe exhausted, maybe patient is sick and they're worried, some personal issues, what not. But make sure, please escalate this to the correct people. The second group that I would like to talk about is our lovely nurses. Yes, as we all love our nurses, but you would face challenging time with them as well, especially if they're rude. You can't reply rudely to everyone, like for instance, I would tell my story. When I started working initially about 2 years ago, I just started working. I'm not sure how the entire system works. I'm still learning, grabbing things, trying to learn the accent, trying to learn what the patient is expecting, trying to learn everything. And then suddenly when you go to someone, can you please do this for me, and the reply you get is, why can't you do it? Are you not competent enough, and whatnot? So if someone's judging you, feels very bad, and they shouldn't. So if they are, politely say this is not an acceptable behavior. And if they're trying to escalate things, man, just have a chat with one of your seniors, because this sort of bossy attitude at times might be okay, because if you're friends with someone and they just making a fun around, goofing around, it's still okay, man. But every time, that's not good. So if you feel that someone is constantly nagging you, someone is constantly bossing you around, and if you're not comfortable with it, speak out. Speak it with, as I said, your wellness teams, speak it with your supervisor, who not, okay? But don't suffer in silence. That's what I always say. This is what I tell to my nursing colleagues as well. If someone is bullying them, just speak up, guys. At the end of the day, we are a part of the team, and you have to go along smoothly. If you can't go along smoothly, you have to settle it out. The third one is every other person, every other medic, non-medic, people working in the admin, anyone can be difficult. For instance, at times, if you discussed some scans with the radiology registrars or consultants, and they've agreed, but the radiographers do not agree. For instance, a very, very common scenario that you might face is someone who needs a CT pulmonary angiogram, or a CT, thoracic abdomen, something which needs a cannula insertion. So now you've got a patient who's very difficult to be cannulated. Very difficult. Everyone's tried. The maximum you can go for is a simple blue cannula. So you call them and you say, and they're just not buying it. They're like, if you get a pink cannula, I'm going to do the scan, or else you forget about the scan. So such scenarios are very difficult, because practicality is, it's not about putting which bore of the cannula, it's like which one is feasible for you at that very time. So whenever you're facing such difficult scenarios, have a chat with them, try to liaise. If you think they're very, very out of track, escalate this, guys. I always say escalate. You might face some difficulties with your rota managers, at times, if you've already requested them for a leave or something, and that at end point they say, oh, the rota is short or something, you would face such scenarios, guys. Have a chat with your supervisors. There's nothing much I can, tell or offer you guys. And the last or most common scenario which you might face is pay related queries, because, at times there's so many organizations, so many employees. At times one of your bank shifts got missed, it might get delayed, or you were deducted too much tax, or deducted something you never took for. So you might face this scenarios, and yeah, it's utterly frustrating when you've worked the month and you've got your expenses ready, and when you get your pay slips or the pay amount, you're absolutely devastated, because this is not what you're expecting. And yeah, at times you would get them through very, very easy. At times you might struggle. I'll give you a simple example. Like about 7-8 months ago, this is what happened. I changed departments, so my pay was given quite less. So I escalated this to the responsible person. They said, yeah, it's all been sorted. The next month I got the same salary. Again, wrote emails and everything, and they said, they've sorted it from there, and it's pending with the payroll. Email payroll, and they were like, oh, they haven't received, so many bits and bobs which were missing from that perspective. But I was paid 3 months less. Yes, that eventually came to you as an arrear, but you had to struggle 3 months for no bloody reason. So you would all face such scenarios, guys. Make sure you're patient. Make sure you're still happy. It's all not stressing you out, because at the end of the day, you're here to help the patients, help your families, help your colleagues. That's why you are a medical healthcare professional. So that is it for this video, guys. If you face any other challenges, get a way out of it, guys. Make something, imaginative, which can, eventually sort your problems. If not, don't suffer in silence. Escalate to your seniors, escalate to consultant, supervisors, wellness teams, and whatnot. Till then, keep liking the videos, and I'll see you in the next video soon. Take care. Cheers. Bye.